Hi, I'm Dr. Katey Nicolai, and I'm back today to answer more of your questions about mental health. So the first question that I have today, how do you find the right therapist? That's a great question. First of all, I'm excited that you want to try counseling for your mental health concern or just to talk about what's on your mind. Thinking that you might be interested in trying counseling is an awesome first step, so proud of you. How to find the right therapist is a lot like how to find the right friend, partner, or just any person that you'd want to be spending time with. It's important to think through what are the things that you're wanting to talk to the therapist about. And I'd say rank your top 3 things. And it can be that you're unsure totally what your agenda is. Maybe it's just a general sense of feeling unhappy with your life. That's okay, it's still a goal. Try to write down 3 topics that you'd like to focus on in therapy, and that will help guide looking for someone who might specialize in one of those things. Second of all, write down 3 qualities that you notice in other people that it's easier for you to talk to. Are you the kind of person who opens up more when the person around you is funny or more serious? Are you the kind of person who needs someone to structure the session for you who's more directive? Or do you prefer someone who's a little bit more gentle and open-ended? Try to write down 3 things. And then when you're making those phone calls and setting up initial meetings with people, you'll have a guiding sense of what you think is going to be the best fit for you. The third thing is really just to try it. Most therapists are nice people. That's why we became therapists in the first place. So just if you're feeling a lot of barriers or you're feeling really nervous about it, just start making those first phone calls and you'll start to feel in your heart when it's right and when you found someone that you can really talk to. So if the first couple meetings don't go well, that's okay. There are other people out there. Just keep searching and just take that first step. And before you know it, you'll be matched with someone who really fits with you. The second question that I have today, what is the best way to support someone who has mental health issues? So maybe it's not you that you're looking for mental health support for. Maybe it's a loved one or someone in your life who's struggling with mental health. I think the first step is to try as best as you can to have empathy for that person. Know that what they're struggling with is not their fault, but something that may be a lot of outside of their control. So once you've really kind of dug into that empathy and tried to build compassion for that person, the second thing to think about is good boundaries with that person. Just because someone has a mental health concern in your life, that doesn't mean that you have to be the only solution available to them. You can certainly be a support. You can certainly be someone to confide in. But if you find that you're the only person in their life that they're coming to for support with their mental health concern, that may be overwhelming, and likely you aren't equipped to cope with everything that they're bringing to the table. Even if you struggled with mental health concerns yourself, or even if you have a lot of experience talking to people who are struggling, it's not the same as being a licensed counselor who has lots of training on how to keep boundaries and also lots of training to know what to do, especially when we kind of get into deep unknown territory. So my recommendation is to have a lot of empathy and compassion, but also to hold your boundary on what you're able to provide and when. And I think as a subset to that, it can be really helpful for people who are struggling with mental health concerns to be their ally and searching for the right therapeutic support for them. Maybe they need help setting up appointments and keeping those appointments with a mental health provider. Maybe they need someone to actually help them take those first steps of making the phone call for them or connecting them to medical care. So I think being their ally in that sense, being someone to partner with them and seeking out professional services can be a really good way to help hold your boundary but still continue to be loving and compassionate towards that person that you care about. So that's my recommendation for supporting someone in your life who has mental health concerns. The next question that I have, how do you cope with being diagnosed? So I'm assuming that this question has to do with someone maybe going to therapy for the first time or going to the doctor and getting a big label placed on them by a provider. Maybe they've received a mental health diagnosis for the first time, and that diagnosis can feel like a heavy burden. It can feel like something really strong and influential and heavy that they now have to carry with them for the rest of their life. Or maybe the diagnosis was something that they weren't expecting. Maybe you thought you were struggling with one thing and now a provider has assessed you and told you, oh, it's actually this kind of concern. That surprised you and it overwhelmed you. I think the first thing to do is to go back to that provider if you can and ask for more clarity around what helped you decide that I was eligible for this diagnosis, or what about my symptoms made you feel that that was the most appropriate one. Just approach it with curiosity, and maybe they can help illuminate more about what that diagnosis means. Also, if you're struggling with a diagnosis and not sure where to go, it may be that you've received that diagnosis, but then there was no follow-up direction as to what to do about it. So you may be feeling like, okay, I have this heavy diagnosis now, but what now? Okay, I know I'm struggling with depression, I know I'm struggling with PTSD, but no one's told me what to do next. Rest assured that there is a therapist out there qualified and an expert in treating whatever diagnosis you have. And that diagnosis can actually provide you with the power to seek somebody who specializes specifically in that type of struggle for you. So use that diagnosis as your power. Be your own advocate and reach out to find specialized care for that diagnosis. And the more you seek that out, the better equipped that person will be to treat specifically what you have going on and hopefully find a good connection in therapy and learn to cope and live with that diagnosis. The last question that I have for us today: do you treat sexual trauma, assault, anxiety, depression? We can really put any list of items on that list and the answer will be yes. There is a counselor out there equipped to handle whatever heavy thing you're carrying around in your life. That might be trauma from your childhood. That might be a recent horrible event that you've had to go through. That might be something mild, like anxiety about taking tests. That might be something really consuming, like anxiety about leaving your house. No matter how big or how small, there is a counselor qualified to treat you. And in 99% of cases, there's a counselor at June who's qualified to treat you. And so I would not let the label of a diagnosis or a fear about what you might be bringing you to counseling get in the way of you reaching out or taking that first step. Even if the first person you talk to tells you that they're not qualified to treat what you're presenting with, that doesn't mean that there's not somebody else who's better suited to you. So just like I was talking about at the beginning, how to find the right therapy for you, make a list of what's most important to you, and then reach out and try to connect with someone and keep trying. And I promise that you'll find the right counselor to support you. So thank you for giving me these questions today, and I look forward to talking with you guys again.